Hello, welcome. I am your host for today's interview. I am Marcella Hill, the CEO of Wake Her Up. And today we are getting to know EVOLVE Telemed. They are an amazing telehealth hormone therapy provider that I have found right in my backyard. They're right here out of Utah where I reside. And we have been discussing and talking about them for months. We were referred to them by many women in our community and finally caught up with them and brought them into our beautiful directory. And I am so excited for you to get to know them. They are providing so much beautiful care for women that are, we all know we're desperately out here trying to find who can help us and where to go and who to call. And this is an amazing, amazing telehealth provider that is going to offer you all of the care that we have all been desperately looking for. So hello and welcome, Dr. Martin and Brianna. Dr. Martin is one of the physicians at EVOLVE, and Brianna is a patient care coordinator who is going to make sure you get all the right things and go all the right places. And so I'm going to start with you, Dr. Martin. I'd love for you to introduce yourself and how you came to be working with EVOLVE.
Well, thank you, Marcella. I'm so happy to be here. My name is Mary Wade Martin, MD. I am a board-certified obstetrician gynecologist, now retired except for doing EVOLVE full-time. So I have morning appointments Monday through Friday, and then a few in the afternoon for those whose schedules dictate that that's best. Although I'm a boarded obstetrician gynecologist and a fellow of the American College of Obstetricians and Gynecologists, I also have extensive training in endocrinology, which allows me to weigh in on fertility issues as well as things like polycystic ovarian syndrome, etc. And along the way, I've learned a lot about men too, knowing that in most households, women choose the health care for the family. So we offer care for men and women.
Oh my gosh, I'm so excited to get into this conversation with you and show women what the difference is before when you were doing gynecology and what you're able to do now and how that transition has been for you. I can't wait to jump into that. Let's jump over to Brianna and introduce Brianna. Hello, Brianna. You are one of the patient care coordinators, and I would love to know how you came to EVOLVE and what has been your experience here.
Yeah, thank you for having me on. So my experience with EVOLVE was I was a patient to start out with. And seeing how it changed my life and being on hormone replacement, peptides. I mean, there's so many options out there for us women to improve our health and longevity that I decided I want to be part of it. So here I am a year later into it, helping patients from start to finish with their getting started with EVOLVE, any questions they have, lab work, medications, and then just continuing care.
I love your position here because I feel like you and I have a lot in common. I mean, I'm not in depth with, making sure people get the exact care, but having the view of kind of that front door, where women come to you and they're like, help, help, help. And you're like, okay, let's help you. For me, I'm like guiding them to you. And so I feel like I get to see the women be so desperate and then get all the help that they need. And it just makes you want to give back more and more and more. So what an incredible experience where you are a patient and now you get to help more women feel the way you feel. So good. Well, if anyone is just watching this on YouTube, or if you don't even know who I am yet, I want to run through some of the symptoms that I was experiencing because I want to grab you. If you're like, menopause has nothing to do with me, perimenopause has nothing to do with you, but you are between the ages of 35 and 50. Yes, it does. So let's just run through really quick what we're even talking about and why you even need this information. If you are not sleeping, if you are itchy, if you hate everyone, if you suddenly have ADHD, if you think your husband breathes wrong and you can't stand him, but you kind of love him, he's a good guy, but like nobody touched you, your libido is in the toilet, everything hurts, you're popping ibuprofen all the time, You are just numbed out. You don't cry. You don't scream. There's like, you don't know where your emotions are. You smell like you're 15 years old because now you have new BO and you don't know what is going on. Your hair is flaky all of a sudden. You have weird phantom smells. You are convinced something smells like smoke, but nobody agrees with you. I mean, you think you're going insane and you're about ready to blow up your life. Hello, this is perimenopause. And all of this can be helped by balancing your hormones. We have a phrase that we say, you're not crazy, it's your hormones. And yet none of us knew this was coming. Somehow women's bodies have been kept a secret from ourselves, and that's insane. So that is why it's so important to know that companies like Evolve exist, because they can literally save your life, save your marriage, create new dreams, create a new life, create a life where you love waking up in the morning and want to live, where you're suddenly listening to your music from high school again, you're rolling the windows down, you have the wind in your hair, you're like, have a bounce in your step and you're good to go. That's what we're talking about here. Okay. We're not talking about just injecting you with medications so that you can numb out further. That's not what we're doing. We're waking you up and bringing you back to you. So Dr. Martin, let's start with you. I am so curious. Why did you make the jump from OBGYN and the things you were doing? Were you in a traditional practice, and what were you seeing when women came in, and what was your experience in being able to help them compared to what you're able to do now?
I think I've always had a very holistic approach to women's health. I was approached very early on, and in fact, in my first practice, right out of residency training, there was a compounding pharmacist whose grandfather had started the pharmacy 100 years before in a little town in Virginia where I was practicing, who said, you know, these women fox hunt 3 days a week, starting the 1st of November to the 1st of April. They don't want to take horse hormones. So let me help you learn about what we have to offer. And I have to say that that was really where things started. I was trained in the traditional manner. For most of you who don't know, yes, we get lectures when we're in residency training, probably once a week. There's a series of lectures, and often we lecture to each other, which is a good thing. But most of the training actually comes from the upper level residents. In other words, the very folks that you're working with. And of course, attendings is too, the senior physicians, particularly in the operating suite or in labor and delivery. So this was new. And as it turned out, no matter where I have gone since then in Virginia, the compounding pharmacists locally, wherever I've landed, have been aware of me. And so there was never really a need for me to prescribe things like Premarin or Prempro or some of those. Bioidenticals just made sense to me. I must add too, my dad was a professional horse trainer. And so I knew how they collected, the urine to make Premarin. And I've known that since I was a child. And it might surprise people to know that horses have 30 types of estrogen, whereas humans have 3. Arguably, there might be a 4th, but using the hormones that were commercially available at that time, this was something brand new to me, and I've just continued on since then. I've always been one to embrace the new things, but I've always stuck by the research, and I continue to read voraciously even now in retirement. It's so much easier now that everything is on the internet.
It's so exciting to me to find doctors like you, because I think a lot of us didn't know that we could look beyond, our network of whatever is covered in our insurance, right? Yeah. We're just kind of stuck, and we've been bouncing around from doctor to doctor trying to ask for help with our hormones. I had no idea that I could go somewhere else and pay out of pocket, but even out of pocket seems to be almost cheaper or just the same as what I would have done going through my insurance. But this is allowing me to go beyond all of the boxes and restrictions and scopes of insurance and actually get the help that I need that is individualized to my body. As a physician, do you feel like you're able to working with Evolve and in a space where it is out of pocket, do you feel like you're able to personalize the care so much more than what you were able to before and also get to know your patients?
Oh, absolutely. Probably the strongest thing that Evolve has, and I've worked for other companies before I discovered Evolve, is the patient care coordinators. No matter how well I think I discuss something or explain something to a patient, it's like being in the exam room. The minute I leave the exam room, the patient will often turn to the nurse, or in nowadays, someone like Brianna, and say, "What did she say again about X, Y, or Z?" And I think what's really amazing is not only do the patient care coordinators, are they accessible to the patients, no matter when, you know that you will get a response from one of the patient care coordinators. But several times per day, I will answer emails or texts or even phone calls from the PCCs about patients. And they're amazing. They, although these are folks for the most part who haven't spent a lot of time in the classroom or the lab, they have learned. And I think I was told long ago that doctor in Latin means teacher. And so I spend a lot of time explaining the mechanisms, how things work, so that the hope is that the minute I have to sign off, that if there's a question that the patient has, they can reiterate or explain it perhaps in different words.
I love that. Yeah. I think all women have had the experience. I just had this experience, not even, just a few months ago, where I went to my OBGYN. The PA is there first, asking me everything that is going on with me, taking all of the notes, walks out. Doctor walks in, asks me all the same damn questions. Like, what was the point of the first 15 minutes? If you're not even going to talk to her. And I think that women just don't know that there's this completely other option where they can come to someone like Evolve, work with Brianna. We're going to be talking to you in a second. Work with someone like Brianna, where they're going to get to know you and talk to you and figure you out. And they're this coach and advocate for you. And then they're actually going to talk to the doctor and they're going to work with the doctor to advocate for you and make sure that everybody's aligned. It's this whole team. And our traditional walking into OBGYN's office does not feel like a team, at least in my experience. It has not felt like that. It has felt like, check that box, that girl did her job, and now that girl does her job. And it just does not feel like a group effort. It feels like you're just repeating yourself over and over. And it's incredibly frustrating. It feels super dismissive, and it feels like nobody's listening. And when you come to a company like Evolve, it is a completely different thing. It is what women have been craving. It makes sense. It feels good. You feel heard. So let's jump into that. Brianna, when someone very first, you guys have an incredible deal where you can get your labs done for $150, which is crazy. I think a lot of women think if it's out of pocket, it's going to be so astronomically expensive. But If you go to an OBGYN and you ask her to do your labs, most insurance companies do not cover hormone therapy hormone labs anyway. So you're end up paying thousands of dollars because your insurance isn't going to cover it anyway. But through Evolve, you can do the $149 menopause startup. And this is where I want to bring you in, because people are going to go to your website, evolvetelemed.com/Marcella Hill, and sign up for this lab. What is happening? Are we going somewhere for the lab? Is someone coming to my house for the lab? And then what point am I talking to you?
So what happens is when you get those labs, it's through LabCorp. And one great thing, I know you're bringing up the obstetrician. Usually when you go to a doctor and you say, hey, I want my labs tested, I feel off. Can you do these? And you'll turn around and they'll give you maybe a testosterone and a TSH for your thyroid. It's not comprehensive. And so that's what's different about Evolve is when you get those labs, they're comprehensive. We need to see everything to understand what's going on inside your body with your symptoms. So Dr. Martin knows how to prescribe the right medications. So we have you visit LabCorp to go through all those labs. I do think they have a thing now where they can come to your house, but there's hundreds of LabCorps out there for anybody to visit. So once those labs come back, I contact the patient, a Zoom. We just go over labs, like marker by marker, starting at the top, explaining what each one is, what they do, and kind of things that would be recommendations when we go in to see Dr. Martin for initial consultation. So once we have that scheduled appointment with Dr. Martin, I review the lab with Dr. Martin. We both are kind of on the same page, and then we visit with the patient. And so we're all intertwined on everything. It's a team effort. So we're on the same page, no repeating everything, twice. So yeah.
Thank you for that. On behalf of all of the women, thank you for that. I'd love to understand, just from a general standpoint, as a care coordinator, when you have women come to you, what is pretty typical where it's got to sound like the same conversation. I'm watching it from a global standpoint, but when women come to you, how would you describe that general first thing? What are some of their complaints? What are some of their symptoms? What does that feel like to you?
I'll tell you, like, the number one thing I hear from patients coming in, nobody will listen to me. I feel like I'm crazy. It's, I'm having hot flashes. I'm having night sweats, mood swings, but they tell me all my labs are normal. But if you go into labs, yes, these are for like people based from like 15 to 80. It's all over the place. It's not optimized for your age, what you're going through. So yes, it may look normal to a doctor that will write it off and say, you're just fine. And so that's where I come in, that no, I can see what's going on and you're not crazy.
The labs are customized for their particular symptoms and stage of life. Yes. Is where you are.
Yeah. So the customized labs when patients come in is hey, I'm feeling a certain way, but I'm being told I'm just fine. So can you help me? I'm like on my last, leg here. I need help. And so, yeah, that's where we'll sit down, go over labs. And, I even take labs from other people that'll bring them in from other doctors. And they're telling me this is normal. I'm like, it's not. We can have you optimized.
I remember going to my OBGYN, having her check my hormones. A week later, getting the labs back, having her say, everything looks normal. You're just getting old. That's just part of the deal. And maybe you and your husband could go to marriage counseling or, try switch things up in the bedroom. I mean, that was my advice, for my low libido. Like maybe it's your husband and your relationship, right? And the first time I talked to a care coordinator at a hormone therapy clinic, it felt like the first time someone heard me and could come back with, we help with that. And then she had additional stories about other patients she had talked to that sounded like me. She even added in things that I had not connected, asking me, are you also tired? Do your joints also hurt? And I was like, that has to do with my low libido. Those are in the same mix. I had no idea. I mean, I was crying on the phone, just thinking, there's help. Someone can help me. I mean, I had no idea. And I think I'd like to ask you, Dr. Martin, why are women being told that their labs are normal, that their hormone levels are normal? I think this is the most destructive thing that is happening in this menopause land right now, is that women are getting their blood work done, thinking and knowing that they are in perimenopause, and then being told, you look normal, you're not in perimenopause, you're too young. Where is that coming from? Why is that happening?
Well, as was alluded to earlier, our labs are comprehensive for a good reason. If your hormones are unbalanced, there's typically 5 good reasons. Okay. And I like to kind of tick them off on my fingertips: insulin, prolactin, cortisol, which is a stress hormone, thyroid, and adrenals. And so our labs encompass those. But if you're a primary care coordinator or a standard OBGYN, you are taught to look at what the lab says is normal. Well, I'm sorry, every lab is a little different, and every patient is certainly different. So we go by the literature. And if a patient, traditionally, they will look and say, well, what about the lab says that if it's a male patient, they'll say, it's that lab says that my estradiol is abnormal, it's abnormally high. Well, LabCorp just happens to bold that. And so the patient is all worried. Whereas what I explain is, well, actually, if you want to know, we want your conversion rate, because 70% of us, men and women, convert testosterone into estradiol. For us, with 2 chromosomes, that's a great thing. We have some extra estradiol, but estradiol varies throughout life, from moment to moment, day to day. For a male, we want at least 4%, 4 to 5% conversion to protect the heart. And so many times when patients look at something and it appears to them, or they've been told that this is so-called normal, in fact, the literature or the Endocrine Society has long ago said otherwise, but people are just not aware of that.
Yeah. I mean, from my standpoint, I have this amazing global group of over 53,000 women that share their labs, that talk about how they feel, talk about at what point they start feeling better, right? I mean, we ask all the time, what's your level of testosterone when you started feeling good? And what's crazy to me is, from what I understand and talking to several different doctors, the normal range is for a total testosterone is somewhere between like 15 and 70 for a woman. And from my view, any woman that is between 15 and 70 feels like crap. and most women don't start expressing that they're feeling good. And when I say feeling good, I'm talking specifically like your joints don't hurt, you're starting to sleep all night, you feel energetic, just like a regular level of happiness. You're not so foggy. You're able to show up for your kids and for your life, and your libido's starting to wake up. And I'm watching those levels be about around 100. Now, I say those numbers because I like giving women a specific reference, right? And I have watched women feel good at 100. I have watched women not feel good until they get to 200. And then some doctors, if you're at 200 testosterone, you are in the like red danger zone on the LabCorp thing, and their doctors are looking at you and be like, oh my gosh, no, you can't be there. But what I love about EVOLVE and how you work with women is that you're listening to their body. I think there's a lot of conversation where you're like, okay, you might be in the red, or you might be in the green or the yellow, or wherever you are on that LabCorp scale, but how are you feeling? And they'll be like, I feel great. I feel amazing. I have none of these. And you're like, well, that's where your body really likes to live then. And I love finding companies like you where I can confidently say to women, they are going to work with you until you feel good, not until you get to the number of 200, not until you get to this number and this equation and this mark on the scale. They want to work with you until you feel alive, until you're sleeping all night, until you have your libido back. And they're going to help tweak things and adjust things until you get there. And then, we're women, we cycle. So as soon as we start feeling good, something changes. We get a little bit older, our estrogen drops, and then we're having to tweak things again, right? And that's why they call it balancing hormones, because it is. You're just constantly, I do these viral videos where I'll say, progesterone, help me, and I'll be on progesterone for many, many months, and it's exactly right. And then my body does something else, and I'm going to have to up my progesterone or change the method of progesterone. And people are like, I thought you were on progesterone. I thought this wasn't supposed to be happening. And I'm like, well, I haven't even hit menopause yet. So everyone just hold on. We're not in this bucket of exactly right that's going to carry us through for years and years. You're going to have to keep working with your body and listening to your body. Okay. One of the things I want to ask you, Dr. Martin, is what are the 3 things that you I should say 3. What are the main things that you prescribe with hormones, and what are the different methods of each of those? And I'm talking about specifically creams to injections to oral. What are all of the options within, I would say, testosterone, estrogen, and progesterone that are available through EVOLVE?
Okay, that's a great place to start. Our goal of testosterone therapy, since you mentioned that, is between 75 and 125. But remember, that's just a goal. And there's more to it than that. Because if we're not looking at your sex hormone binding globulin, in other words, how much bioavailable testosterone is there, then we could start having other problems. There are a whole lot of women who have excess androgens that really have nothing to do with testosterone, which is why we're looking at the adrenals as well as the thyroid, as well as the insulin. There are many of our patients, for instance, whose problems, the most common, and that's why I start with them, are insulin and prolactin. But getting back to your question, we favor the injectable, and this is why. The pellets are wonderful and don't stimulate the clotting cascade, which is what makes subcutaneous placement of a pellet, or because obviously I'm long distance here, we use the injection. But we inject it subcutaneously, in other words, under the skin into the fat. Now, if you've ever eaten a pork chop or a steak, you know that fat is light in coloration because there's very few blood vessels there. But there are a lot of lymphatic vessels. And that's the purpose. We want the testosterone or estradiol or both picked up by the lymph nodes and then go through the spleen and eventually into circulation. And this is why. Anything that you swallow or inject into a muscle goes directly into circulation. And unfortunately, the liver destroys 85% of everything you just administered. So we find that by using subcutaneous, tiny little insulin syringe, it's no bigger than a straight pin and a 1/4 inch long. And we use the belly because we've all, no matter how thin we are, we've all got a little fat underneath the skin in the belly. That in the course of just a few weeks, we've got steady state levels. In other words, we're missing that first pass to the liver that would destroy 85% of everything. And it's almost like a slow release by putting it into the fat. If a woman is perimenopausal, and what do I mean? She's in the transition years. And this could be up to 10 years before she has her last period. That may surprise people. Occasionally I'll run into someone who says, oh, I was completely menopausal at 42. Well, having the experience I have now, yes, it can happen, but it's a bell-shaped curve. The average age of menopause is 52. So that means by your 52nd birthday, half of all women will have not had a bleed in 12 months. That means the other half are still in the process. So I have women who are still bleeding at 55 and 56. They're on the tail end, and others who are finished at 45 and 46. The 42-year-olds get mad as heck when I find another reason that they're not having bleeds. But on the other hand, would you like the accelerated aging that comes along with the early menopause when it's actually not menopause at all? It's another endocrine disorder. Again, maybe it's prolactin, maybe in a lot of cases it has to do with insulin. So we look at all of those things.
I love that you said that they get mad because their period comes back. I have a lot of people that start on, I watch women share their story where they start on hormone therapy and their period comes back and they're pissed and they actually are thinking something's wrong. Like it's not working right because they started bleeding again. And to your point, we're figuring out like what's going on with your body. Why did it shut down? Maybe possibly too early. Maybe
Yes.
there's some reason why you're having erratic periods and now you're going to be regular again, which you get your 27-day cycle back, which is not fun, but I mean, your body is going to function better. And I love that you brought that up. That's not something that a lot of people even touch on, that it might come back.
Yes, it might. On the other hand, I can recall, as I was going through it personally, being in the operating room, doing a hysterectomy or doing a complicated case and bleeding more than the patient was, because that was something that I experienced personally too. And I'd be asking the anesthesiologist, could I have some Toradol, please, so I can finish this case? Now, if you're suffering, obviously I wasn't treating myself, and we learn as we go along. I learn every day from patients and the patient care coordinators. But at that time, it hadn't all gelled. And of course, it's also been a few years now, too, in my case. But, if you have an intact uterus, then we're going to suggest progesterone. And it's real progesterone in all cases. We're giving 17 beta estradiol, which is exactly what the ovaries produce, 17 beta testosterone, again, what the ovaries produce, and progesterone, the micronized progesterone, which is not a progestin, a synthetic like you would find in birth control pills or IUDs or some of the patches and other products. These are identical to what we have. And again, the thing is balance. I always say it's like whack-a-mole. You get one thing under control and then something changes. But that's the fun of what we do.
Well, and I think that when you're working with a doctor like you, where you are tweaking and listening to your body and teaching your patients to listen to your body and asking them, how does this feel? How does that feel? For me, it has given me the power to advocate for my body. And it has given me the knowledge that I am my best person to listen to what is good and what is bad and adjusting things. And we're not here to say, this is what works for everyone, 200 milligrams of progesterone, and that's what we do. And, it feels like I can say 200 milligrams kind of makes me feel a little bit tipsy. What if I went to 150? What if I went to 100? What if, during some weeks I'm like, maybe 200 is better for this week. It gives me power over my own body, and it takes the fear out of it, where I'm respecting my body. And I know what to use to get the results I'm looking for. And I love that you're empowering women to do that. Brianna, I want to come back to you because I want to ask you, when women are working with Dr. Martin and Evolve and everything you have, after, I don't know, when would you say, a woman comes to you totally desperate, going out of her mind, that's day one. When would you say you start hearing the stories of like, holy crap, I slept all night. Oh my gosh, my libido turned on. My bones don't hurt. What would you say is probably an average frame of time? And I caveat this. I have seen women be like the next day, and I have seen women have to tweak this for a year. And women want to feel better yesterday. I get that. But I always want to say, if it takes you 5 years to figure out how to feel good, it will have been worth it, because 40% of our life is going to be spent in menopause. So if somebody, if Brianna says 1 week and you're not a 1 weeker, you still got to stick in this because we need you to feel good. So, but what would you say is pretty average when you start hearing those stories?
So, it goes depending on how severe symptoms are. So I'd say the more severe symptoms, the quicker they'll see results, because they're getting that relief sooner. So I would say within a couple of weeks, I'll get women saying, oh my gosh, you are the best thing ever. Like, I wish I found you guys a long time ago. I'm sleeping so much better. I'm happier. I can't wait till what week 4, week 6, week 8 looks like. And so it just really depends on that patient. But any small little improvement, I went through this as a patient, that you see is like, I don't want to go back to how I felt at all. And so you just keep marching forward and you just keep improving. So yeah, it's great to hear patients, Dr. Martin hears it, how grateful I am for you guys of helping me with this health journey and feeling a lot better.
As a patient, what was one of the most surprising side effects that went away? Maybe you were surprised. You were like, oh my gosh, I didn't even expect that. Just tell me a little bit about your experience and what started feeling good.
So my biggest thing when I started with Evolve is I found out I had Hashimoto's, which is when your thyroid gets attacked by your immune system. And so when I came in, I met with Dr. Martin and didn't even realize I had PCPs tell me, you're just fine. They didn't even offer me, they gave me levothyroxine, which is T4, wasn't even paying attention to all my thyroid labs, and I wasn't feeling any better. I was laying in bed, I had no energy. And then I met Dr. Martin, and we went over Hashimoto's. We went over, what medications are appropriate. And within, I'd say, like weeks, I started feeling so much better. And then that turned into, okay, I want to do peptides and, testosterone. And now we're feeling great. So
it's amazing. When you say you're feeling better, can you be specific? What are the symptoms that went away?
Oh, symptoms, fatigue, low libido, hair falling out, dry skin, nails were the top ones for me. Fatigue was probably the biggest one that went away with treating with my thyroid and testosterone.
You know what the most surprising thing to me was that wasn't even on the symptoms list when I went to the hormone therapist was the itchiness. I think I have itched my legs every night for 10 years, probably after I had babies. I think I have itched my legs every night. I will itch them until they bleed, thinking I'm not drinking enough water. I need to find the right lotion. Like, what is wrong with me? I'm going to have just scars like covering my legs. And even to the point where my husband was like, you have to stop itching your legs. And I had not even realized I was on hormone therapy for probably 2 months. And I was having a conversation with a woman about hormone therapy and how amazing it is. And she said, my favorite thing is that my ears don't itch anymore. It's just the inside of my ears. I had gone to so many ear doctors and had done the drops. We were looking at surgery. We were scoping it, thinking I had bugs in my ears. Something was in there. And I was like, wait, itchiness goes away. And then I backtracked and realized I haven't been itching my legs. Like, it's not even a thing anymore. And in fact, when I itch my legs, my husband will say, are you low on testosterone? Did you forget to take your shot? Like, what do we need to do here? Right. And we start adding it up. I was like, oh, I have been a little moody. Oh, I have not wanted anyone to touch me. We start adding it up. But the itchiness was, it is like my go-to sign of when my T is getting low. And I think when you start into this process, I'm sure you guys see like women start connecting to their own bodies probably for the first time.
Yeah. Yep.
And I have a theory, and you guys, you tell me what you think about this. Because women have been disconnected from their bodies for so long, because it just sucks to live in here when it hurts, right? So we just go up in our heads, but now we're starting to drop in, we're starting to feel good. Would you say that as women start feeling good, we also start noticing new things that maybe we didn't see before? Would you say that is happening?
Yeah. It's like you check off one thing and then it's like, okay, now that this is fixed, wait, what is this? And so, it goes along with what you were saying is balancing those hormones. It's, we're taking care of one thing and then you realize something else is array. So
I feel like these hormones are, literally turning women back on. So it's almost like we've been in the dark and the lights come on and we're like, oh, what about that? What about that? Oh, gut health. Oh, what? Like, why are my nails flaky? You just start seeing it because you're actually turned on. You can actually think about it. You can actually have the capacity to deal with it. And I think a lot of women, it freaks them out. I think a lot of women start hormone therapy and then think these are symptoms, like they're coming from the hormone therapy, but you're actually just starting to pay attention to your body now. Yeah. And I think that I want women that are listening to this to know that when you turn your body back on, that if you're working with a company like EVOLVE and Dr. Martin and Brianna, this is where they catch you. You're no longer being treated like pieces. Right. You're being treated as a whole thing. And that we want to encourage you to express all of this that's happening. All of the emotional things. I think finding doctors like you and companies like EVOLVE are so amazing to me, because you're worried about, oh, wait, you're caring for your dying mother. That's going to play into your hormones. Oh, you're going through a massive divorce. You have all this PTSD, you have all this trauma that's playing into your hormones. And I've never talked to doctors that treat you like a whole thing. Right. And I think that it's beautiful to find women like you that are involved in a company that encourages you and teaches you and wants you to treat women as a whole thing, where you have to consider lifestyle. Dr. Martin, maybe you have a story to share of maybe a success patient, maybe sharing that story helps us understand what women can hope for.
Gosh, there's so many. I don't know how I would narrow it down to one. The commonest thing I hear is, why haven't I heard this before?
Yeah.
And, I can't speak for other doctors. I just know that this has been my approach all along, being very holistic. I also wanted to throw in there that, addressing hormone therapy, we have a wonderful 10-year window of opportunity that helps to prevent dementia and other aging problems. But, getting on it in the perimenopausal year, I'm not saying that, if you're 75, you wouldn't benefit from hormone therapy, but in general, the earlier, the better. So we don't always start estradiol, for instance, in a woman who otherwise is having menstrual bleeds. We know she's making enough estradiol. That's why the lining of the uterus withdraws and she has a bleed. But certainly we can support her lean muscle mass and her skeletal structure and her brain by using testosterone during that time. And she will tell us, and the labs will tell us, when it's time to start adding some estradiol and progesterone if appropriate. So, gosh, I'd have to say more not only is it the perimenopause, but the women with histories of endometriosis, for instance, or women who've had hysterectomies and oophorectomies, removal of their ovaries early in life, who didn't know that they could actually go back to feeling like they did earlier in life. And there's just so many that I wish I could tell a story, but they're all different and they're all remarkable.
Well, I am so grateful to know that you exist and that you're here. And I'm so excited to share just yet another amazing telehealth company that women need to know that it exists. I think right now there's this huge, massive movement around perimenopause and menopause. And we're hearing about the documentaries and the books and it's on Good Morning America. But at the end of the day, the question still remains, where do we go? Right? I mean, all the education of perimenopause and menopause in the world, we still need a doctor to call that actually applies that information. And here you are. So if you have listened to this and you are like, these are my people, this is where I'm at, you check all the boxes, it is time for you to feel good. It's time for you to feel awake and alive and want to wake up in the morning. So if you go to evolvetelemed.com/me, Marcella Hill, and you can schedule your labs for $149 and start with that menopause startup kit. And then you're going to meet with someone like Brianna. And then you're going to also meet with someone like Dr. Martin, who is going to make sure that you get yourself back. Brianna, Dr. Martin, it has been such a pleasure. And you are out here saving lives, literally saving lives. You are awakening women from a state of feeling dead inside to actually wanting to participate in their lives. And that is changing the world. So I want to thank you on behalf of all the women that are about to come and find you and start feeling awake and alive. I just really appreciate you. Is there anything else you'd like to add before we go?
I just want to say, for those women that are coming in, there is help, and us PCCs and the doctors are here to listen. Like, we're here. So with any questions.
I love us so much. Dr. Martin, anything you want
to?
Nothing to add. I think we've said it all. Welcome.
Well, there's probably a ton more to add, but we'll just have to do another one of these to make sure, we cover it all. But please know that it matters that you feel awake and alive. and the world needs you. So go ahead and go to EVOLVETelemed.com and get started. I feel like an infomercial now, but it really does matter, and it really can change your life. So with that, if you need any other support, also go to wakeherup.co to join in with our amazing global community and get all the support you need. With that, everyone, have a great day.
Thank you.
Thank you.